Here are 10 Puerto Rico Medical Board-style clinical vignettes focused on physiology, cardiac cycle, and ECG interpretation, with 4 answer choices and detailed explanations. Cardiac cycle and ECG interpretation clinical vignettes. 1. Phases of the cardiac cycle. A 23-year-old athlete undergoes echocardiography, which shows normal heart function. During isovolumetric contraction, which of the following occurs? A. The aortic and pulmonary valves are open. B. The mitral and tricuspid valves are open. C. Ventricular pressure is increasing without a change in volume. D. Ventricular filling is occurring. Answer C. Ventricular pressure is increasing without a change in volume. Explanation. Isovolumetric contraction occurs after the closure of the mitral and tricuspid valves and before the opening of the aortic and pulmonary valves. The ventricles contract, but volume remains constant. 2. ECG atrial fibrillation. A 67-year-old man with a history of hypertension and heart failure presents with irregular palpitations. His ECG shows absent P waves and irregular QRS complexes. What is the most likely diagnosis? Atrial fibrillation, B. Atrial flutter, C. Ventricular tachycardia, D. Second-degree AV block. Answer A. Atrial fibrillation. Atrial fibrillation AFib is characterized by absent P waves, an irregular rhythm, and varying RR intervals due to disorganized atrial activity. 3. ECG AV blocks. A 75-year-old woman presents with dizziness. ECG shows progressively lengthening PR intervals followed by a dropped QRS complex. What type of heart block is present? A. First-degree AV block. B. Mobitz type 1 AV block. C. Mobitz type 2 AV block. D. Third-degree AV block. Answer B. Mobitz type 1 AV block. Explanation. Mobitz type 1 AV block shows progressive PR interval prolongation until a QRS is dropped. 4. ECG. ST elevation myocardial infarctions. A 60-year-old male with crushing chest pain for 30 minutes is rushed to the ER. ECG reveals ST segment elevations in leads 2, 3, and AVF. Which artery is most likely occluded? A. Left anterior descending. B. Left circumflex, LCX. C. Right coronary artery, RCA. D. Posterior descending artery, PDA. C. Right coronary artery. Explanation. ST elevation in leads 2, 3, and AVF indicates an inferior MI, most commonly caused by RCA occlusion. Pressure volume loops. A 52-year-old woman with hypertension undergoes echocardiography. Compared to a normal patient, which change is expected in the pressure volume loop? A. Increased end systolic volume. B. Decreased end diastolic volume. C. Decreased afterload. D. Decreased stroke volume. Decreased stroke volume. Explanation. Hypertension increases afterload, which reduces stroke volume by increasing end systolic volume, residual blood in the left ventricle. ECG, ventricular tachycardia. A patient with a history of myocardial infarction presents with syncope and palpitations. ECG shows wide QRS complexes, no P waves, and a rapid ventricular rate. What is the likely diagnosis? A. Atrial fibrillation. B. Ventricular tachycardia. C. Supraventricular tachycardia. D. Mobitz type 2 AV block. Answer B. Ventricular tachycardia. Explanation. Ventricular tachycardia, VT, presents with wide QRS complexes, 120 ms6, no P waves, and a rapid heart rate, 100 BPM. It can degenerate into ventricular fibrillation, VF. HAS7, ECG hyperkalemia. A patient with chronic kidney disease presents with weakness and palpitations. ECG shows tall, peak T waves and a widened QRS complex. What is the most likely electrolyte abnormality? A. Hypocalcemia. B. Hyperkalemia. C. Hypokalemia. D. Hypernatremia. Answer B. Hyperkalemia. Explanation. Hyperkalemia causes tall, peak T waves, widened QRS complexes, and can progress to sinus arrest or ventricular fibrillation. 8. Cardiac cycle, heart sounds. A 5-year-old child has a holosystolic murmur at the left lower sternal border. What is the most likely cause? A. Aortic stenosis. B. Mitral regurgitation. C. Ventricular septal defect. VD, tricuspid stenoser. C. Ventricular septal defect. Explanation. VSD presents with a harsh holosystolic murmur at the left lower sternal border due to blood flow from the left to right ventricle. 9. ECG atrial flutter. A 62-year-old man presents with palpitations. ECG shows regular sawtooth waves in leads 2, 3, and AVF. What is the likely diagnosis? A. Atrial fibrillation, B. Atrial flutter, C. Ventricular fibrillation, D. Sinus tachycardia. Atrial flutter, explanation. Atrial flutter is characterized by sawtooth P waves, usually from a reentrant circuit around the tricuspid annulus. 10. Frank-Starling mechanism. A healthy patient is given IV fluids, increasing preload. How does this affect stroke volume? A. Increases stroke volume, B. Decreases stroke volume, C. No effect on stroke volume, D. Decreases cardiac output. Answer: A. Increases stroke volume. Explanation: the Frank-Starling mechanism states that increased preload and diastolic volume increases stroke volume, enhancing cardiac output. Final thought.